Greetings, everyone. Thank you all for joining us today at the beginning of American Heart Month. My name is Lachlan James, and I'm a community health worker for AmeriCorps, and I work out of MyCare Health Center in Centerline, Michigan. For those who may be unaware, MyCare Health Center is a federally qualified health center that provides comprehensive medical, dental, and behavioral health services throughout Macomb County and beyond. It is my pleasure today to be joined by Tessa Adams, one of MyCare's physician assistants, who is going to be talking to us about the importance of heart health, especially in women, and why American Heart Month is so important to MyCare. Before we get into that, though, let me turn over the mic to Tessa to introduce herself and the important role she plays at MyCare. Tessa, it's all you.
Thank you, Lachlan. It is my pleasure to be here today, and I'm looking forward to an exciting discussion. For those of you who just may be joining, my name is Tessa Adams, and here's a little bit about me, what a PA does, and how it's different from other providers. As I said, I am a physician assistant here at MyCare Health Center. Physician assistants, they're also known as PAs. We are licensed providers to practice medicine in all specialties and settings. PAs can evaluate, diagnose, and develop treatment plans. We can order and interpret tests, prescribe medications, and even assist in surgeries. PAs are trained to collaborate with all members of a healthcare team in order to provide our patients with comprehensive care, as opposed to other providers, such as medical doctors, DOs, or even nurse practitioners. They typically have to specialize in a certain field of medicine.
Excellent. Thank you so much for providing insight into your role and the important function that PAs have in ensuring our community health here in Macomb. And as everyone is aware, this February, this month, is American Heart Month. And actually, it's very exciting. This is the 100th anniversary of the celebration. So a very significant figure. And today we're going to continue to raise awareness about cardiovascular disease. So I would like to ask you some questions, Tessa. What are some of the most important risk factors women should concern themselves specifically in regards to cardiovascular disease?
It's a great question. I'm going to start this by just explaining a little bit about what cardiovascular disease is, and then we'll get into some of the risk factors. So cardiovascular disease is a term that's used to describe diseases affecting the heart and our blood vessels. Some examples of cardiovascular disease are coronary artery disease, arrhythmias, heart valve disorders, and peripheral artery disease. There are lots of risk factors for developing cardiovascular disease. One of them is having hypertension, also known as high blood pressure, smoking, including vaping, excessive alcohol use, an unhealthy diet that's high in fats, sodium, and sugars, a lack of regular physical activity, having type 2 diabetes. We also know that family history, age, your sex, income, and other social determinants of health can also increase one's risks of having cardiovascular disease.
Wow. I especially on the community sort of public health side, that's extremely interesting. Thank you so much for the information. I also wanted to ask you, what are the signs of symptoms that a person who is experiencing cardiovascular disease, what would they be presenting?
That's also a great question. I'd like to preface my response by saying that not all of these signs and symptoms indicate that you do have cardiovascular disease, nor is this a complete list of the signs and symptoms associated with cardiovascular disease. Some of the more common ones that I see clinically are chest pain, and chest pain that might radiate to the jaw, the arm, the neck, shortness of breath, especially shortness of breath with exertion, palpitations or a fluttering feeling in the chest, cramping in the legs with physical activity that resolves with rest. We call this claudication. Also swelling in the lower extremities. So the lower legs, ankles, or feet could indicate that one may be having cardiovascular disease complications.
Oh, that is so good to know. And Tessa, last question, can you please share any advice on how women can take proactive steps to reduce their risk of heart disease?
Absolutely. Although heart disease is the leading cause of death in the United States, there are plenty of measures that you can take to help prevent it. One of those being get adequate and high quality sleep, maintain a healthy weight, exercise regularly, and increase your overall physical activity. So this doesn't have to necessarily be going to the gym and lifting weights or running. This could even include things like sports, walking, weightlifting, yoga, dancing, and among many other things. Some other things you can do to prevent cardiovascular disease are eating a healthy and well-rounded diet. So avoiding foods, as we said previously, that are really high in fats, sodium, or sugar. Quitting smoking is a great step in abating your risk of cardiovascular disease. And again, this includes vaping. Um, we know that smoking is a big risk factor for cardiovascular disease specifically, but it is also a risk factor for developing lots of other chronic diseases.
Awesome. Well, hey, Tessa, thank you so much for taking your time today to talk to us about heart disease, especially during this important February, the 100th centenary of American Heart Month. I'd also like to say if you or someone on the call needs to schedule a checkup, that information should be right on your screen along with a link to learn more about American Heart Month and how you can participate. Thank you again for everyone joining us, and thank you again to you, Tessa, for providing all of this information.
Thank you, Lachlan. It was a great discussion.